So you may have heard that RFK Jr. recently made an association between autism, acetaminophen, which is the active ingredient in Tylenol, and circumcision. And when I heard this, I had to take a step back and really try to analyze what he was saying, because a lot of what he was saying wasn't overly clear, didn't make a lot of sense. So what he was doing was he quoted two different studies related to circumcision and autism, and then hypothesized that it was due to the use of acetaminophen as a pain reliever afterwards. Now, let me address the first one, the first part of that. Regarding the autism and circumcision, the big study that was quoted was out of Denmark, where they looked at 340,000 plus patients, of which 4,000 of them, so a little bit more than 1%, who were circumcised. Circumcision is not typically happening in Denmark. But in the 4,000 people who were circumcised, they did show about a doubling of the effect of having an autism diagnosis. However, they did not take anything else into consideration, such as location. Obviously, if people were living in a certain area of the country, maybe they had toxic exposures in that area. But also, even in terms of genetics. Let's face it, in a small majority, in a population like that, where a small minority are being circumcised, more than likely they were Jewish or Muslim. Okay. Now, of course, that means that from a genetics perspective, you're talking about a pretty selective genetic pool. It's a little different than what a typical Scandinavian pool would be. And that wasn't taken into consideration either. And we know that genetics and environment have a huge role when it comes to autism. So what do you actually make of that? At most, you can call it a weak association, correlation. You certainly can't call it cause. But the other part is this. When it comes to the circumcision and Tylenol part, we do not give acetaminophen after a baby is circumcised. First, the most common things that are done is either what's called a dorsal penile block, kind of like a Novocaine shot to the mouth, where there's a certain area where they can give an injection that numbs up the area. Secondly, the other thing that's done is either breast milk or sucrose water. The sweetness, when given right before the procedure, actually causes a release of the endorphins, which are the pain relievers of the brain, which is then done to calm the baby and to have an analgesic effect. But acetaminophen is not something that is standardly given as part of or in recovery for a circumcision procedure. So for the call out there for making this connection, in especially here in America, it's not done. I don't know if it's done elsewhere in the world, but it's just not something that's done here. So anyways, I don't know what to make any of this stuff, but it just seems like there was a lot of information that was put out there that was really either poorly associated or really not substantiated at all. Have a good day.